Hello everyone, it's been a pleasure to be a part of Udai Omni Hospital. I am Dr. Pritee Sharma. I am a vascular and an endovascular surgeon. I am been trained from Topiwala Nair Medical College and done my general surgery from Western Railway Jagjivan Hospital. After that, I did my D.N.B vascular surgery from Army Hospital Research and Referral Center, Delhi. I have been attached to Udai Omni Hospital since last year. Here I am going to discuss in brief about what is varicose veins, how to diagnose it and how to treat it. Now, if it is very surprising that it's a very common disease which has a prevalence of 1 in every 6 patients has varicose veins, with the chances of females having it much more, and the percentage can go up to 40% for an average Indian woman, and it can be up to 20 to 25% for an average Indian male. So it's a very common disease. Unfortunately, what has happened is we just tend to ignore it. We don't pay attention to it, and the final stages in which the patient comes to me comes with an ulcer and black skin and in lot of pain. So I would like to take this opportunity to give knowledge and really make you all wiser in how to know that you have varicose veins. Now, the common symptoms with which the person who has varicose veins will have is like there is a dragging or a pulling kind of pain which is there in the legs, more so in the evening time, more so when you are doing some activities by standing for a long time, or you had a long travel and then you notice that there is swelling which is there around your legs. So these things, if they keep on coming more frequently, then be aware that there might be chances that you're suffering from varicose veins. Now, another pattern in which the patient can come to me is only swelling is there but there is no pain, and there are some color changes like it is becoming brown or black around the ankle area. Now, that is another typical presentation in which it has been ignored, more so because we don't really care so much about our health. So these kind of patients need to see a vascular surgeon earlier and get themselves evaluated. Now, the way I would, once a patient with these symptoms comes to my clinic, is I would see what the problem is, assess for the arterial circulation and do a scan, a Doppler scan, to see how bad the vein is affected. Now, once a patient has been diagnosed as having varicose veins, who has a reflux in the superficial system with the deep cysting being normal, the treatment options are either doing an open surgery or a minimal invasive surgery. Now, with the advance in technology which has occurred, there are various ways in which minimal invasive methods can be used to treat varicose veins, which start from either doing a laser surgery, a radiofrequency ablation, a mechanico-chemical ablation, or glues which have also come up. Now, it is very important to understand whether these kind of procedures are really indicated or not, because at times the symptoms might be just related to other pathology other than varicose veins. So for the better understanding is like a patient has dilated veins. So there is a superficial system and there is a deep system, and they have been connected by valves, something like the hinges which are there between the doors. So by nature, the flow of blood has to come from the superficial, that is the outer system, via the valves, the perforators, going to the deeper system and then getting pumped up to the heart. So if there is any problem in the deeper system or if there is any problem in the superficial system, patients will have symptoms which are similar to this. A patient who has a normal deep system and has only problem in superficial system should be the candidate to undergo any of the minimal invasive procedure or a compression stocking. But if somebody has problem in the deep veins, then we should be cautious, do more further evaluation before offering any form of procedure. Now, another way of treating veins is by giving compression stockings. These compression stockings are basically tight stockings which will physically compress these veins, so that when a patient is standing, Now these veins are bigger in size, dilated. When you compress them with the stockings, those symptoms will disappear, and if you keep on doing your calf pump exercises, the blood gets propelled up to the heart. So this is one way in which the disease will not progress and the symptoms will decrease. But if you want a permanent cure, then yes, depending upon the pathology, a minimal invasive procedure is the best option. And at Udai Omni, we have all available facilities to treat varicose veins. Thank you.